Welcome, everyone. We'll just give a few minutes for people to join. So, good morning, good afternoon, good evening. Welcome to today's EPI-WIN webinar. It's the 40th EPI-WIN webinar this year. So, thank you all for being part of this journey. Today is a very special webinar because it talks about the future of public health intelligence. The topic is building the future of public health intelligence with the launch of the Public Health Intelligence Competency Framework and Curriculum. In today's world, navigating public challenges is not easy, and we need a workforce that can, um, uh, you know, work on it to provide timely, evidence-based information and act on that. So this is what this competency framework and curriculum will look at. And we have for that some very eminent speakers today. But before that, for those of you who are new to EPI-WIN, it stands for the WHO Information Network for Epidemics. And our goal is exactly that, to make science and knowledge in health emergencies um, actionable, understandable, and accessible for evidence-informed actions. Uh, For today's webinar, we have Dr. Philip Abdelmalik, who will provide the welcome remarks and also talk to you more about the competency framework. And then we have Raquel Medial Dia Carrera, who's an epidemiologist at the WHO Hub for Pandemic and Epidemic Intelligence at the Berlin, also at the Berlin Hub, like Dr. Philip Abdelmalik, who's the unit head there. She will also talk a little bit about the framework a little bit more. Then we have the privilege of having with us Professor Johanna Hanfield, who's the acting vice president of Robert Koch Institute. And with her, we have Clarissa Lage Barbosa, epidemiologist at RKI, and they will talk about why PHI is so relevant for global health security and the project where they've collaborated with WHO on that. So now you know about the framework and why it's relevant. But what about the practical implications? How do you use it in the countries? For that, we also have the privilege of having Dr. Nada Hossein with us. She's the director and of Ministry of Public Health in Lebanon, and she will speak about Lebanon's experience. After you've heard Lebanon's, the country experience, we will now then go back to learning about how to use this competency framework and curriculum so that all of you who've joined will be able to use it and know what to do, and it will come to practical use to all of you. And as always, after that, we will answer your questions and answers. So before I hand over to Philip, though, some housekeeping. As you know, we love to hear from you. You can already see from the chat, those of you who have been part of the EPI-WIN family, please introduce yourself in your chat, who you are, where you come from, what you do. I just love seeing how people from all over the world get together and do share your insights. This is as much about sharing your insights with each other as about listening to what's here. So do share your insights there. If you have questions, though, please put the questions in the Q&A box, and our speakers will try to respond to as many questions as possible. So in the chat, a little bit about you, your insights, your experiences, anything you like, but in the Q&A box are your questions. Also today, this webinar is being recorded, and the recording will be shared with you. It will be on our website as soon as we can get it up there. And so do come back to the EPI-WIN website if you want to go to the recording. Then uh, we also have interpretation in two languages today, French and Arabic. So at the bottom of your screen, you see the globe symbol. If you go there, and you can choose the language you like for interpretation if you want to go there. Then finally, this is a platform for learning from each other, for exchange of information. Let's keep it positive, constructive. All discussion should be positive, constructive, and respectful. Um, and also to the topic. Please keep to the topic at hand. Anyone who is disrespectful will be removed from the webinar, but I hope we don't need to do that. And with that, as you know, what we love to do is start with you. So here is our Slido, and give me a minute for that, please. Um, so just give me a minute for the slide. It's slido.com. Can you see this? It's slido.com, hashtag 2318297. We'd love to hear from you. This is simply to know, are you currently working in the area of public health intelligence? Because I know all of you come from a wide range of backgrounds. Yeah, it looks like from the responses so far, the majority of you are. Okay, great. So the majority of you are working, at least from the responses we've got so far, from the 95 responses, you are working in this area, but a significant number of you, a third of you, are not. So great. You learn something new then, and hopefully useful to you. I will, as usual, keep the Slido on for a while, but hand over now to Dr. Philip Abdelmalik, Unit Head at the hub in Berlin, for the welcome remarks and to talk more about the curriculum. Over to you, Philip.
Great. Thank you so much, Supriya. And first of all, I guess, good morning, good afternoon, good evening, wherever you might be. I was noticing the numbers continuing to climb in the number of participants, now to over 600 participants. So it's really a pleasure to have all of you here. And welcome to the launch of the Public Health Intelligence Competency Framework, and of course, its companion, the Public Health Intelligence Curriculum. We're delighted to have colleagues from all over the world here, different institutions, different sectors. I was trying to keep up with the chat just to see who was on, and I'm not able to keep up with all over 600, but I did notice that really there's representation from ministries, from journals, from multiple different areas and domains. So this is really, really great, and we appreciate that you've made time to join us wherever you might be in the world. We're also grateful to the EPI-WIN team for hosting this session and for giving us the opportunity to present these resources within this webinar series. As public health systems increasingly face complex challenges, whether these are emerging diseases or climate shocks, demographic change, humanitarian crises, or just simply rapidly evolving information environments, which we're all living in. Our collective ability to protect populations, and of course to respond appropriately, depends on an essential function, and that's the function we're discussing here today, and that's strong public health intelligence. And you might be wondering, what do we mean by strong public health intelligence or public health intelligence at all? And we'll get to that in just a minute. But the two resources we're discussing today, the framework and the curriculum, were both developed to articulate the competencies needed for effective public health intelligence practice and to provide practical, adaptable learning pathways to build and sustain those capabilities. They reflect extensive consultation, not just with member states, but also with academic institutions and many, many partners around the world from the public health community. And I'm delighted that we've also got two of these represented here today in RKI, as well as in the Ministry of Health in Lebanon. And of course, RKI has been an important partner, as well as various other CDCs and national public health agencies and institutes around the world. The framework and curriculum are not static documents. And just like our landscape is constantly evolving, our learning has to as well. So these are living resources. And as science, technology, and practice evolve, our approach to how we build intelligence capacity also needs to evolve. And so our hope is that these tools will support countries in strengthening preparedness, accelerating evidence-based action, and of course, nurturing a professional workforce that's confident, capable, connected, and evolving as this landscape evolves. So I do want to express my sincere appreciation on behalf of the Hub and Health Emergencies Program to all who contributed to this work. The list really is quite large and extends to many different organizations and experts, like I said. So if I were to start listing those, I would take the entire webinar and would still probably miss people. So I won't do that. But I do want to acknowledge Raquel as well, who coordinated this work stream and is going to guide us through a high-level overview of these two publications in just a few minutes. Before we explore the framework and curriculum in detail, I want to briefly anchor us in a shared understanding of what we mean by public health intelligence, why it matters, and why developing the public health intelligence workforce is so critical. And so I want to do that through a series of 3 slides. If we could bring those up, please. There we go. So first, I mentioned or asked the question earlier, what is public health intelligence? And you can see a definition here on the screen. This definition is taken from UN Terms, which is a website from the UN that has definitions for various terms that we use within the UN family. But in short, and to summarize, I'm not going to read it, but to summarize, what this reflects is an end-to-end process which transforms information, which is often and increasingly incomplete or fast-changing, varied, and coming at us in extremely large quantities. So it's an end-to-end process to transform that into reliable, actionable insights. And these are insights to guide decisions, both before and during, as well as after, real events. So the definition underpins both the framework and the curriculum. And really, intelligence is a product of these activities that are described here. If we move to the next slide, then, why does this matter? Well, again, we've got a few things listed here on this slide, but we've seen time and time again, whether it's pandemics or environmental crises or conflict or humanitarian crises, credible analysis, rapid insight, these are crucial to determining the speed and effectiveness of our responses. But they're also really important in terms of transparency and accountability and building trust in terms of how decisions are made and making sure that these decisions, as much as possible, are based on appropriate insights and intelligence. And so if we move to the final slide that I'm going to speak to before I hand over to Raquel, hopefully it sort of becomes a little bit evident why it's so important to develop the public health intelligence workforce. Because we've got some clear messages from all of the different events that have happened recently, that have happened in the past historically, and that continue to happen. People with necessary professional competencies are crucial. The new generation or next generation of public health intelligence practitioners really are going to be the ones defining the future. And we have to update and solidify and harmonize these competencies so that we're all speaking a common language and can understand each other. Doesn't mean that we all have to do things exactly the same way. We have to do them in a way that's appropriate for our context. And we've tried to reflect that in the framework and curriculum. But at least we have to try to come together to be able to address these issues that affect all of us in a common language and with common understanding. And that's the role of the framework and the curriculum, to provide this sort of shared standard, if you like, and a practical pathway for building and sustaining public health intelligence capability around the world. So with that foundation, I'm pleased to hand the mic over to Raquel, who will walk us through these two products. So thank you, and over to you, Raquel.
Thank you, Philip. Good morning, good afternoon, colleagues around the globe. It's a real pleasure to be here speaking on behalf of an enormous group of experts from WHO as well as from many other institutions and organizations, some of them here with us in the call, to present this collective work of experts trying to develop and define public health skills. We will first start briefly presenting the PHI Competency Framework and the PHI Curriculum, and then Professor Johanna and Clarissa Lago Barbosa will move forward and describe some more work on the actual implementation and the public health intelligence foundational training that has been developed based on the curriculum. The competency framework highlights competencies, functions, and tasks that are essential for the public health intelligence workforce, while the curriculum has been mapped to the competency framework to introduce courses and learning objectives that enable the public health intelligence workforce to develop essential competencies, knowledge, skills, and abilities. Professor Johanna and Clarissa Lago Barbosa will then share a bit more about how the PHI foundational training introduced important concepts and processes in public health intelligence and has been developed as a standalone training that can precede implementation of the full public health intelligence curriculum. We will then also hear from Dr. Nada and the experience in Lebanon following some beautiful collaboration work with the WHO Eastern Mediterranean region and the Robert Koch Institute in Germany. So in the next slide, I just want to dive a bit very quickly into the different phases of key steps that were considered to develop and implement all this work we are presenting. Firstly, understanding what were the gaps, what were the needs, what existed already, and what were the requests from countries around the globe. That led to work in a collaborative manner with quite a number of partners on developing a competency framework and a public health intelligence curriculum, and in parallel, implementation and piloting of public health intelligence training through series of online trainings. We've had some of our epidemic intelligence and public health intelligence trainings available in Open WHO for already some time, and now we are also working with the WHO Academy to, together with the Robert Koch Institute, publish some more of our PHI trainings. In addition, and we will discuss shortly with the presentation coming next, how some of these public health intelligence trainings based on the competencies and the curriculum have been piloted in a number of member states. In the next slide, we just want to share with you, and we're extremely excited to launch here the Public Health Intelligence Competency Framework, which highlights the essential PHI competencies for the workforce. These competencies are illustrated through tasks in technical and functional domains. And these tasks define essential skills and knowledge for public health intelligence professionals, cover data collection, analysis, interpretation, communication, policy transition, and it serves both as a training tool as well as a reference for institutions to align PHI competencies with the real world needs. Next slide, please. Those competencies are illustrated through tasks distributed in 4 technical domains: that are based on the steps of the PHI process, including detection, verification, analysis, and assessment, and a functional domain covering collaborative information exchange. And I want to, at this stage, also give a shout out to the Public Health Intelligence Unit in Geneva, in WHO headquarters, that have done an enormous amount of work around defining this process for public health intelligence and the key activities on it. And next slide, please. The curriculum complements the public health intelligence framework and suggests a structured training approach for public health intelligence professionals to develop necessary competences and knowledge, skills, and abilities. The curriculum allows development of knowledge, skills, and abilities through courses and a series of learning objectives. And in the next slide, you can see how the curriculum aligns with the same technical and functional domains as the competency framework and translate the tasks from the framework into courses and learning objectives, including 4 technical domains and 1 functional domain. Next slide, please. So, in summary, here is just a recapitulation of what we are here presenting on behalf of the enormous group of partners that have contributed to this work, with the great guidance and technical expertise of the Public Health Intelligence Training Working Group. And in the next slide, I just wanted to take a moment to acknowledge this enormous group of colleagues and experts that have made this work possible. I cannot mention them all. There were a number of experts that have got us all far. I just want to briefly say, and I believe that we have connected with us, Catherine and Madison and Adam and Christy and Stephanie, a huge thanks, because they've been essential, along with many, many other colleagues, to get us to where we are now here. So a huge thank you once again, and excited to hand over back to you, Supriya. Thank you.
Thank you very much, Philip and Raquel, for that overview of this wonderful framework and curriculum. So now I would like to invite Professor Johanna Hanfield and Dr. Clarissa Barbosa to talk about how this is important for global health security. So over to you, Dr. Johanna.
Yeah, hi, colleagues, friends. It's fantastic to be, and an absolute pleasure to be part of this important moment. We've heard about the launch of the Public Health Intelligence Competency Framework and the linked curriculum. And what we're discussing really today, or what we're presenting, is something that's right at the heart of global health security. And in the times that we live in, unfortunately turbulent times, investing in strong public health intelligence is more important and more urgent than it ever has been. So if you click right through the slide, I just wanted to briefly introduce from our perspective as RKI, and we've been great partners with the WHO Hub for Epidemic and Pandemic Intelligence here in Berlin, and then crucially lots of partners and partner countries in the EMRO region, and some of whom are online now, had the pleasure of co-developing this. So the reason public health intelligence really is so essential, or is such an essential part of global health intelligence, of global health security, is really because it's core to that early detection, risk assessment, and the rapid action. So without these systems in place, and without the common language that Philippe alluded to, it's really hard for countries to detect the outbreaks early and to then respond, and ultimately to protect their populations. So what the recent emergencies, I think, and obviously everyone talks about COVID, but also Mpox and others have shown, as well as the consequences of ongoing conflicts, is that information is in abundance, and Philippe alluded to this. So we're seeing more and more information, but it's really about this information turning into intelligence. So once it's analyzed, contextualized, verified, and translated, can be translated into action, that we as national public health actors, national public health institutes, can respond to that. And because our crises are covering multiple geographies, and international collaboration is so important, it's really important that we have this common language. So that's why the framework, to have this baseline that we share, has been so vital. and it has been so important to develop this. And you see here this journey began in 2021. I noticed Philip had the same slide on had the same picture on his slide of Chico Ihewazu opening this very early collaboration where we began this work. And the second point, perhaps, if we go to the next slide, then is to say that the training that goes hand in hand is that the workforce is so essential in this, right? So the backbone to a public health system and to any intelligence are the people. So while we need the common definition, we also need the training, or we also need the playbook to then do the training and building those pathways into capacity across countries. So I will hand over to my colleague Clarissa Lage Barbosa, who really has been coordinating this project within RKI. I wanted to say it's been an absolute pleasure to work with the WHO team on this, but also to work with the country partners. I'm delighted the colleagues from Lebanon are on board. We worked with in the Emro region piloting this in 4 countries, and this process really helped us to develop the products we're launching today. And with that, over to you, Clarissa Lage Barbosa, to take the colleagues through the project and the work in greater detail. Thank you.
Thank you so much, Ms. Sannefeld. On the next slide, I will start to show how this piloting of our training development pipeline, how it went, and as addressed by Philippe Raquet and Ms. Sannefeld right now, the PHI Competency Framework and Curriculum addresses this gap on the need for standardization in the PHI process. So the RKI played, as Raquel also mentioned, we co-led the development of the PHI Competency Framework and Curriculum being launched to date. And as part of this collaboration in our project too, the RKI had also co-led the PHI working group together with the US CDC too. That was a very important group revising all the documents and providing PHI expertise throughout this project of creation of the training too. So I'll briefly explain the pipeline of the training development. We developed the PHI Foundations training in alignment with the PHI Competency Framework and curriculum. And we then piloted the training in 4 countries in the Eastern Mediterranean region, in Djibouti, Egypt, Jordan, and Lebanon. After that, we did an evaluation with the participants right after the training, and also after 4 months of the training being delivered there. And after the evaluation, all the documents, all the materials were revised, and then for the dissemination part, we finalized doing the revision of the material and are now in the process of adapting the materials for e-learning and the certification. If you go to the next slide, please. I will just show here how the training we built a practical foundation in PHI skills, also tailored to the country needs, focusing on the sustainability of the PHI strengthening activities. So there was this training, the PHI Foundations training, based on the PHI framework and curriculum, but also country-specific customized training. We also focus on a regional network building and strengthening between the participating countries and the partners in the regions. And we also promoted a technical exchange because focus on the sustainability, there should be a peer-to-peer learning too. We also had all these activities, the technical exchange and also a regional engagement meeting were crucial for the network building among the 4 pilot countries, but also in the regional level, creating this regional engagement too. After this all has been done, we did an impact evaluation of the training and are developing a sustainability guidance for PHI strengthening activities. I'll give you just a brief overview in the next slide of what this PHI Foundations training enhanced. We had 8 topics, for example, introduction to PHI, what are the legal, ethical, and regulatory frameworks for PHI, the sources of information, how the PHI process and activities are, how to implement PHI, what is the epidemiology for PHI, how do you do PHI during public health emergencies, and also very important, the stakeholder engagement communication. The training was a mixture of presentations, discussions, small group activities, polls, and also experience sharing. And we developed in materials where a range of slides, a very detailed facilitator guide, also a participant package where they had the exercise and the key points from the training, and also provided an online resource repository for the participants. And in the next slide, you can see, it's just an illustration very briefly of how what Philip once said. It's those photos, I think, can show more than any words that we can say here, and how this training was highly engaged, and we received a very extremely positive feedback, where the participants highlighted how this level of interactivity in the training was also crucial to have a comprehensive and holistic view of PHI, and how they could incorporate many sources into a One Health and All Hazards approach for PHI. And the next slide is briefly, even though we had a short evaluation time, we could already see the great impact of the training and the impact the training or any training based on the PHI Competency Framework and PHI curriculum can have. And the participants reported they established a PHI collaboration among the 4 pilot countries, but also on a regional level. The country level communication was strengthened. There was enhanced PHI knowledge and skills among the workforces, and also the gaps and how PHI is implemented were identified and are being targeted now for support. And as Ms. Hanfeld also highlighted, I think these results, they show how working together with strong trust and shared purpose, like the RKI, the WHO Hub in Berlin, EMRO, and the national institutions that work with us, how you're able to break down silos and then work across borders and institutions through a common goal, which is to enhance knowledge, skills, and awareness for the PHI process among the workforce, strengthening then the PHI capacities and competencies around the world. Thank you, and back to you, Supriya.
Thank you very much, Professor Johanna and Clarissa. Thank you for explaining and how you get different countries together on PHI. So with that, let's hear from the country experience, and thank you for joining us, Dr. Nada Kosen from Lebanon. Please, the floor is yours. Tell us about Lebanon's experience.
Thank you very much for this opportunity to present Lebanese experience. I will put the video off because I have some problem with the internet.
That's fine, thank you. Professor, we can't hear you. If you could put your video off, maybe that might help, yes, with the bandwidth.
So I will slide. So
Professor Kosen, are you still there? We can't hear you or see you.
Yes, do you hear me now? I have some problem. So thank you very much for this opportunity. So I will present about Lebanese experience. So if we can see what is, why do we need to have public health workforce development for global health? If you go to the next slide, please. So why? Because local workforce development contributes to global health. The global picture reflects the practices at local levels. To better act globally, we need to ensure our best locally. In case of emerging diseases, we need to have timely detection, timely verification, timely analysis, timely assessment with effective communication. So we can be able to ensure timely response, including containment at the source. Next slide, please. And why do we need to train local workforce? And what does this mean to train local workforce? This is to have a natural capacity building, transfer of knowledge, skills, and attitude to a wide range of actors across sectors, health and non-health, and also across levels, central and peripheral teams, and to build our critical mass of PHI actors and users to not be disrupted by any emergency. In Lebanon, I will take an example for media and social media screening, which are part of the EBS detection. So before the pilot phase, we had a small team at the central level doing the task on daily basis. And we here, when we have a turnover, we may face some risk of disruption of the activities. But following the pilot phase, so we have more team trained from peripheral levels, which are trained and requested to monitor official and unofficial data sources, so to have more data about any signals and events. And also other sectors have been involved in the training. So what training did we have in Lebanon? So in 2024, we have the honest sessions for public health intelligence, for the public intelligence for open source and rapid risk assessment. And then this year we had the face-to-face workshops in June and in December. And the audience included people from health, but also agriculture and education, including peripheral and central teams. Next slide, please. And so why do we need to decentralize to have better workforce working for public health? But here we need to also to be nearby the event, and so to ensure timeliness of the operations of public health intelligence. And here we need to have resources and to ensure that competencies are available at peripheral levels. In Lebanon, with a pilot phase, we have decentralized the operations of PHI. Before detection, verification, analysis, and assessment were done only at central level. Peripheral level were only contributing in verification. But after the training, peripheral levels are also contributing to detection, verification, and analysis for the one conducted by FPTP. Next slide, please. And here, for the curriculum, we need, as they said, my colleague, we need to have unified language and also unified methods of practice. With the same language, we have a common understanding and effective communication across sectors, countries, and also we need to have to adopt same practices to have a systematic way of handling data from epidemic intelligence to public health intelligence. Next slide, please. And here we have some figures from Lebanon from Jan to 11 November 2025. From the signals filtered and reaching the central team for the daily meeting, we have 153 filtered signals, selected 141, verification 137, true were 130, and authenticated 130. And the most common conditions were food poisoning, rapid exposure, and hepatitis A. And when we looked at the timeliness of verification, it was 96%, and for the timeliness of investigation was 93%. Next slide, please. So what is the next? We have to continue forward. We need to train more staff in various sectors and various levels, and we want to build capacity in risk assessment and to monitor and evaluate our work and to expand the tools to automate social media screening and to expand to other sources, especially community-based surveillance, so we can have more timely detection of any signals in the country. And thank you very much. I acknowledge the WHO at headquarters Berlin, EMRO, and country office, also the RKI and my team. Thank you.
Thank you very much, Dr. Nana, for sharing that experience very beautifully and concisely. Now we hand it over. We've heard from the Lebanon experience. Now I request Philip and Raquel once again to tell us how this framework and curriculum can be used, the practical way forward, so to say.
Great. Thank you very much, Supriya, and thanks to everybody for the questions. There are some really interesting, difficult questions, which we do appreciate. I've been trying to answer some of them and realizing that I'm probably spending way too much time answering individual questions. at length. So, but please do keep them coming. In terms of the implementation and application, maybe I'll just start with asking Raquel, and maybe we can do this as a bit of a back and forth, Raquel and I. Raquel, who is the audience, would you say, for these two products?
Well, thank you for the question, Philip. This public health intelligence competency framework can be used by both public health intelligence professionals that might be interested in conducting a self-assessment or career development. It can be used by policymakers for strategic planning and capacity building initiatives. And it can also be used by employers, those that are in charge of recruitment, performance evaluations, and workforce planning. The public health intelligence curriculum, it has been designed thinking on trainers, those that deliver public health intelligence instruction in universities, in field epidemiology training programs, in applied public health settings. It's also designed for learners across all levels, from new professionals to experienced staff who might need refresher training. And also, the curriculum has been designed for organizations, those developing and strengthening public health intelligence training programs.
Thanks, Raquel. So maybe let's start with the framework, the competency framework itself. Maybe tell us a little bit, run us through this slide that we're seeing in terms of its application.
Well, it can be applied for workforce development, design new curriculum and training programs. It can be used to revise existing training and education, as well as to support professional world. The main scope is across both the local, the national, regional, and global contexts, applicable to government, NGOs, academia, industry. And one key consideration is that our framework and curriculum has an all hazards and One Health approaches, in expanding much beyond infectious diseases and human health to encompass all types of health threats that can affect the well-being of populations across the globe.
Thank you. And if we think about how we apply this, and also about the sort of the learning pathway, so as we move into the companion product, I guess we could call it the curriculum, can you maybe walk us through that slide on the curriculum learning pathway?
Absolutely. So as you can see here, we encourage using the curriculum, considering starting with planning the training, identifying the target audience roles, and selecting the relevant courses within the curriculum. We recommend completing the Foundations of Public Health Intelligence training that has been developed in collaboration with the Robert Koch Institute and the Eastern Mediterranean Regional Office, as mentioned by Clarissa, through this very nice presentation, and where learners can gain information on the background of public health intelligence, skills, and knowledge. Then we recommend to complete the selected technical domains across the other courses in the curriculum, and complete also the functional domains to learn so learners can gain desired functional competencies and skills. This way, learners can possess knowledge, skills, and abilities needed to carry out public health intelligence tasks effectively.
Thank you, Raquel. And while you were speaking, I'm still sort of trying to look at some of the questions. Some of, I think, the questions are answered through some of these slides, so hopefully that helps. But since you've walked us through this journey, the learning pathway, maybe we can switch to the application of the curriculum now, which is the next slide that we've got.
Well, it can be used to design new public health intelligence training programs, as well as support higher education courses, or for refresher or advanced training modules for experienced workforce. At an organizational level, it can be used to establish or revise public health intelligence trainings across government and other institutions. It can be used to guide adaptation to local, regional, and global contexts, as well as applying it in resource-limited settings or well-established settings. The curriculum has been designed with a modular and adaptable approach that can respond and be adapted to the needs, roles, and experience of the workforce. It can, has also been designed in a way that it can be adapted for in-person, virtual, hybrid, or self-study, and be relevant for quite a number of different profiles that require to perform the PHI function, from public health intelligence officers to epidemiologists, field epidemiologists, surveillance officers, and much more.
Well, thank you. I guess that sort of also leads us then to the next slide, which is about how to use them. So maybe I can hand that over to you and then you can wrap up this part. Thanks.
So how best to use the framework and curriculum? In the framework, you might want to identify the technical domains most relevant to your current requirements and select the appropriate needed tasks in those technical domains. Then within the curriculum, the key recommendation is to identify courses that cover the appropriate or the needed tasks from the framework and complete those courses to develop desired competencies, knowledge, skills, and abilities. With that, if we move to the next slide, just to conclude, we want to share with you all the links and QR codes to the different websites and resources, again, with a huge recognition of the enormous group of experts that have worked in this work across many, many partner institutions across the whole globe. Huge thanks, because we will not be here without them. Feel free to please check the resources. I think there might be nice bedtime reading for you, both the competency framework and curriculum. And thank you again to all for the interest. Back to you, Supriya.
Thank you very much for that interactive session, Philip and Raquel, where you did answer a lot of questions that were also coming up there. And thank you also for the resources. Now it's time to actually answer many of the questions and there seem to be quite a few questions out here. So the first one I will ask is a question by Ukian sharing, but also this has been reflected by many others asking the similar question, because it looks like there's some confusion here. So the question he asks is, how does public health intelligence differ from traditional epidemiology in terms of scope, data sources, and types of decisions it informs? Additionally, is there alignment between the public health intelligence competency framework and the quadripartite competencies for One Health Field epidemiology framework? So who would like to take this? Philip? Do you want to start? Have a go? And then maybe Raquel?
Sure. Thank you for giving me the difficult question. I'm happy to let Raquel answer the second part on Kofi, because I think there's actually been quite a bit there. On the first one, that can be a more controversial discussion, I suppose, and there have been a number of questions about the same sort of concept. How is this different from surveillance? How is this different from, when I say this, I mean public health intelligence. How is it different from event-based surveillance was another question. So I think, first of all, I think it's important to say that, when you say traditional epidemiology, it's important to note that public health intelligence isn't really a new concept. I mean, that phrase has been used and can be found back in the old international sanitary regulations going back to the 1800s. So this concept of public health intelligence isn't new. In fact, I would say it is and should be a part of traditional epidemiology. I think the second thing to say is that it depends a little bit on your definition of surveillance. We tend to define public health surveillance as being also an end-to-end sort of process where it's the systematic collection, collation of, depending on which definition you go with. Some definitions say health information, some just say information. And of course, it's, analysis, interpretation for decision making. I would sort of say that I think the outputs of surveillance, and this was one of the answers I put in the chat, feed into the generation of intelligence. But that surveillance is not the only factor that feeds into the generation of intelligence for public health to inform decision making. So some would argue probably that all we've done really is taken surveillance and maybe added to the definition a little bit, or inflated it, or just used the same definition and added more words to it. I think that becomes a little bit of a personal thing in a way. There are different definitions of intelligence out there. We did do a landscaping of that when we first started this framework, and we did a lot of consultations. And it's clear from the consultations that there is confusion. If you have a chance to take a look at the collaborative surveillance document that WHO put out, I guess maybe a couple of years ago now, that might help a little bit in looking at the distinctions, or not distinctions, but complementarity between surveillance and intelligence. And we've defined their collaborative surveillance as an approach that seeks to generate better intelligence. So perhaps if you look at it that way, as, you know, surveillance being a process, intelligence being a product of that and other activities, that might help a little bit. But it is an interesting conversation, one happy to have outside of this forum, because we could probably have it for days. With that, maybe I'll hand over to Raquel for the One Health comment, and Kofi.
Thank you. So to complement, we have been working very closely with the WHO team, but also the quadripartite that has worked on the competencies for One Health field epidemiology. Highly recommend this framework as well. And we have worked from the beginning in aligning and outlining how both are very relevant complementary products, with the competencies for One Health field epidemiology having slightly more defined target audience, mainly the field epidemiology workforce, while our public health intelligence competency framework having a much wider audience as a target. We have work, and I've been part of the expert group, as well as Philip, that contributed to the COFFEE framework, and the experts leading the COFFEE framework have also been part of the expert group revising our framework. So yes, it's a fantastic question, and highly recommend you all, particularly those on the FETP side interested in strengthening One Health competencies, to check that framework. Thank you.
Much, Raquel. And Philippe, well, your quote has got think surveillance is a process, intelligence is the product. It was well received. Thank you, Raquel, for explaining that as well. The next question, I think I will ask Dr. Nada Kosen. She's answered it in the chat, but I think this might be helpful to everyone who's listening. It's a question on what sectors were trained in Lebanon, and what other sectors would you expand to? The reason I think others might be interested is it gives them an idea of how expansive this is and where it would be useful. So, Dr. Nada, the question is
Thank
to
you for the question. So when we talk about other sectors, the first thing we have to think about agriculture. So we have the One Health approach between human and animals, but also environment. So we have also the environment involved. So usually Lebanon, when we want to have other sectors involved with us, we think about agriculture, environment, and education. Why education? Because in education, 30% of the population are in schools. So it's a way also to reach a community through the schools. So usually we have the three partners: agriculture, environment, and schools. Thank you.
Thank you very much. There's another question by Abu Hamza. There's, of course, a number of questions on what kind of trainings would be available, but maybe we can share that separately. But there's a question from Abu Hamza. How do we ensure data reliability when multiple sources from digital platforms to field reports provide inconsistent information? Who would like to take that? It's a difficult one again.
Can take it if there is no other volunteers. Oh, I saw Philip unmuted. Philip, you can go ahead.
No, sorry, you go ahead, Raquel.
Thank you. So it's quite a tricky question, and I don't think there is not a gold standard response. We highly encourage, and the public health intelligence framework encourages using multiple data sources from different, not just platforms, different channels, different providers, to try to generate insights and understand as best as possible the context and the situation of the health threat of interest. We need to be aware that when increasing and using multiple sources, some what might be official, some might be unofficial, there might be inconsistent information. And I think that's part of the role of the public health intelligence professionals to analyze and assess, verify, consult, double check, and assess the reliability of such information. And there can be different processes to be done to verify the reliability of some of those information. We want to also highlight that something we've been working in WHO over the past few years is around misinformation around health. Over the past few years, it's been detected that around certain health events, quite some misinformation was often generated. So the expert judgment of the health professionals, and that's part of the skills and competencies needed by public health intelligence professionals to assess, verify, and interpret the different information that is available to ensure that's used in the assessments accordingly. So I don't think there is a gold answer, but in summary, the expert technical assessment is always required. Thank you.
Thank you very much, Raquel. I hope that answers that was a complex question, so I hope that answers what the person had in mind.
I think Johanna might want to complement, right? Johanna?
Yeah, please, Johanna. I'm sorry, I didn't see your hand.
No, that's fine. So I just wanted to add precisely to what Raquel said. That's also why we are moving, why we need good surveillance and the public health intelligence at this moment. We've got multiple sources of information now. We've got the traditional surveillance systems, but it's about creating intelligence, making sense out of that through a systematized process that analyzes and verifies and contextualizes that. So you've got lots of different data sources, but you need to look at them in a consistent manner to turn it into the intelligence. And I think that's precisely where we are, because the data sources are so multiple, right? So we've got lots and lots of information, but making sense of that information is turning it into intelligence. So there's also a reason why we're now focusing more on public health intelligence, or why this is needed now as a common language in an era where we've got lots of different information, right? So you have to have this systematic process at the heart of it, where you look at it consistently over time. Sorry, just to add to Raquel's answer. Thank you.
Thank you very much, Professor Johanna. That also clarifies a lot as well. And we are now at the end of the hour, but there's one question which was answered in the chat, but I think may be of interest to others. That was on artificial intelligence. So the question here was specifically on Latin America, but might be useful for other countries as well. This reviewed documents highlight the transformative potential of artificial intelligence in public health, emphasizing the need for comprehensive preparedness for effective implementation. So the question was, how can countries overcome digital divides and ensure equitable access to AI technology? And what training and competency development strategies in AI are most effective to prepare the public health workforce for ethical and technical challenges posed by this technology? You've answered it in the chat, Philip, but I thought everyone might also want to hear it, because this is very relevant to today's world. So, Johanna, would you also like to have a go at that? And then I hand it back to Philip.
I'm a little bit nervous because I haven't read Philippe's answer. So
Okay.
I'm not going to be able to address the digital divide completely. But I think if done right, AI obviously offers a potential to leapfrog. At the same time, and there's again a lot of work done as part of this project as well as part of other collaborations on how to use AI and those mechanisms as part of public health intelligence. So I think there's actually huge potential there to address some of the digital divide that we have seen due to AI. But I've also got to say, again, we need to do this in a systematic manner with competencies attached. But Philippe, I'm curious to learn from you what your clever answer was.
I don't know how clever it was or how satisfied the person who asked the question is with my response. It's not too different from yours, although I added a few additional points. So I think in my answer, what I mentioned at its core, I agree with you that this has the potential to leapfrog. And one of the things that I did say is that it has a transformative potential. But in order to recognize or realize that transformative potential, there has to be an investment in it. It's not just going to happen by itself. That investment, in my opinion, means that it has to be built in by design when we're designing public health activities or public health practice. So it needs to be part of the thinking around the infrastructure. And I recognize when there is a digital divide, that's much easier said than done. But I think nonetheless, it needs to be thought about. And in order to be thought about by design, there are a few key ingredients we have to think about. One is, of course, what are the foundational pieces that are needed to enable it? And once those are identified, then we can try to find solutions together. Another one is the governance piece. We can't just, implement AI without bringing in a responsible lens to it. Well, you can, but then you end up with negative consequences, right? So highly ill-advised. I think another thing as well is that we need to think about the global picture that we are in and the power of collaboration. And so that means that, there are opportunities to leverage freely available open source products, for example. There are opportunities to twin together with others who are working in that domain in order to get expertise or get help with designing infrastructure or architecture. So this collaborative approach, I think, is really important, whether it's around infrastructure, whether it's around governance, or whether it's around actual implementation. So I do think it's an important discussion to have. It's something we do need to think about as a global community and how we can support one another and how we can build this up, because whether we like it or not, it's coming. It's here. It's not even coming. It is here. And if we don't find ways to leverage it appropriately, I think then certain areas of our practice will be left behind.
Thank you, Philip. Thank you very much. We have come to the end of the time, but Clarissa, is there anything you would like to share as well? We didn't get around to asking you a question, but would you like to add
Thanks,
to?
Cyprian. No, thank you. I think I've been trying to answer some of the questions that came up more on the technical side on the chat too. But yeah, thank you.
So thank you very much. There are many other questions, but well, we have time restrictions, but it was very interesting and very informative session. So I would like to thank each and every one of the speakers, Professor Johanna, Clarissa, Dr. Nada, and of course, Philip and Raquel. And thank you for taking the lead in organizing this. I'd also like to thank the people who worked in the background. You have Michael, if you look carefully at that big table in that screen there, they're Michael and Maria Isabella. They've been doing all the work in the background and helping out. There's also Lester from our team sitting in the Philippines, who's also helped. Thank you to the interpreters for making this more accessible to so many others, and to our IT support, and also to our collaborating center. We have Aditi here with the slides, supporting with the slide sets. But most of all, thank you to everyone who participated and made this webinar what it is. Thank you for your interest, in your questions, and also for the wonderful emojis coming up right now. It's great to know. And this is the second last, as I said, it's the 40th EPI-WIN webinar this year, the second last of this year. We still have another one, and I hope you will be able to join us next Thursday. This time it's not on a Wednesday, it's on a Thursday. I hope you can see this. So it's on community protection and cholera, how to launch an integrated community response for cholera. Lessons from Zambia. Zambia had very successfully managed to get together the different components of community for a cholera response, and they published about it. So this has implications for other countries who can follow and adapt to it. So that's for next week. But for this week, thank you very much. You will also, if you have any further questions, write to us at epiwin@who.int, and we will forward your questions to all our speakers if you want to if there's anything relevant. And please do continue to join us. You will get the recording and the presentations in our website. And have a wonderful day, the rest of the day. Thank you very much and goodbye. Bye.
Thank you. Bye-bye.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye bye.